Okay, well, welcome everyone to the Human Services Committee meeting of Tuesday, November 28th, 2023. We have a quorum. Do we need to take roll, though? Okay. Oh, I almost got it.
Councilmember Harris,
Present.
Councilmember Burns,
Here.
Councilmember Harris,
Here.
Councilmember Ravel,
Here.
Councilmember Reed.
Okay, we have a quorum, so we can do our work. Thank you. The first item is approval of the minutes of our October 2nd meeting. Could I have a motion on that?
I move for the approval of the regular minutes from October 2nd, 2023.
And a second?
I will second that.
Okay, thank you. Any comments or questions? Then all in favor, please say aye.
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 Opposed, no. All right, the minutes are approved, and now we'll move on to public comment. I'm going to start with the people who've signed up here in person. And first we have Nina Paleologos. Yeah, thank you.
Hi, everybody. I'm here talking about the beekeeper
Right,
license
yes.
issue. Thanks for your attention. You know, I don't want to repeat everything that I went over last time, but I do think that I have shown pretty effectively through pictures, and I sent you all a video about a week and a half ago that I hope you've watched that shows the aggressive nature of the bees in Miss Nisi's hives. And also, I think importantly, shows that despite the fact that she's kept bees for a long time and may have good intentions about being a good beekeeper, I think there's a fair amount of inexperience there that I think we've documented, such as in the video you see her talking about how agitated her bees are and how aggressive they are, how there were swarm cells that she noticed the week before, but notably didn't do anything about them, and then there was a swarm. And then that video was made where you see the bees dive bombing her and attacking her. That was made like late May, early June. And in the memorandum, it says she quickly requeened her hives, but that's not true. I have texts here from her where I'm texting her photos of my sister's eye sting that I had provided pictures for you guys, and that was July 23rd. So there were many, many weeks with multiple complaints before, and that in that text, and I can read it to you, where she's considering requeening and talking about how she had just done an inspection, and that riles them up. And I think that a more responsible beekeeper would have requeened, and our ordinance, as light as I think personally it is, our ordinance specifies that if the bees are acting aggressively, that immediate requeening should be done. And that didn't happen. It was weeks and weeks and weeks later. So I feel that, that keeping bees, it should not necessarily be a right if they're inflicting harm on other people nearby. And, I think there are other options for Ms. Nisi. She can have her bees off-site. There's a community garden, literally 3, 4, 5 blocks away, where the bees would then be able to pollinate the garden that they're there. The entomologist that came, this most recent evaluation, I described the stinger that I pulled out of my sister's eyelid, and she said during that, that sounds like a bee. And in her report, she says it was probably a honeybee. She can't prove it without a photo, but in the memorandum it says, she can't tell. But she thought it was, just like I thought it was. And, there were several suggestions that were made to move the hives further away or different area of the yard to the opposite side of the yard. Miss Nisi was not eager to do that at the time. That was my impression. She suggested to Miss Nisi to move them off-site to a community garden, and I had said, oh yeah, there's one right not very far. And she didn't really want to do that. And I think that that's being uncompromising. She could also decrease the number of her hives. so that she only has one hive or maybe two instead of three really large hives that are getting bigger with overwintering. So I respectfully ask that you deny her license. Otherwise, I'm not sure what the point is of even allowing people to ask for that or to complain about them if, despite people getting stung and despite people being dive bombed and really put out by them and hurt by them, if that's not enough, do you know, to make
Yep, so,
us...
thank you.
Thank you.
I know. And then we have Ann Pantoga. And if you could keep your remarks to about 2 minutes, please.
I will. Thank you. Thank you, members of the committee. A license is a privilege, not a right. And again, I'm Ann Pantoga. I am Dr. Paleologos' attorney for this. Ms. Nisi kept the bees on her property for maybe approximately a year without a license, during which time we don't know for certain, we believe that she probably did not have an adequate water source because those bees were going to neighbors' pools for water supply. We understand that the goal for the city in any ordinance is to have the residents comply with the ordinance. And that, but the ignorance of the law, the fact that she had bees for a long time without checking on an ordinance, is really not a defense. And then if she were a good beekeeper, neighbors would not have an issue. And it's not just Dr. Paleologos that had an issue. It was initially raised to the city for them to do an inspection, for her to get where she found out she needed a license by another neighbor who made a 311 report to the city. So I think the question, too, is who has the burden? Does the objector have the burden here, or what's the burden on this? The ordinance requires that beekeepers ensure that a water supply is available at all times so the bees will not congregate at swimming pools, bibcocks, pet water bowls, bird baths, or other water sources where they may cause human, bird, or domestic pet contact. Water must be maintained so it not to become stagnant. The ordinance also requires for queens, in any instance where a colony exhibits unusually aggressive characteristics by stinging or attempting to sting without due provocation, or exhibits an unusual disposition towards swarming, it must be the duty of the beekeeper to requeen the colony. And queens must be selected from stock bred for gentleness and non-swarming characteristics. And it's prohibited to keep a bee colony in the city if there's a swarm. So we would just ask that it be denied. If not denied, then we would ask that the council take the recommendations that Dr. Paleologos stated or redo the ordinance so that there's more restrictions. Thank you.
Great, thank you. Mary Nisa?
I'm not going to address anything that they said because it was frankly character assassination and frankly ridiculous, but this is what I have to say. 10 days after the first hearing on September 1st, in the path between our houses, my husband discovered a giant yellow jacket nest in a crack in the staircase on the east side of my neighbor's house, about 3 feet from her backyard and pool. Yellow jackets look almost exactly like honeybees, and they are aggressive and carnivorous and start hatching in late June. Ms. Paleologos' guest was stung on July 25th. I immediately sent the videos to the Department of Health, assuming that would end this ordeal. It is absurd that Nina surmises that she can somehow litigate nature so that she can sit by her pool and not have to interact with bugs, or by bullying by the Department of Health into going expert shopping for anyone to side with her. In order for Nina to have a case, it requires several coincidences of unnatural behavior from insects, bees randomly attacking, a wasp nest sprouting up in September, and even if it was a bee, there was no way to prove it was my hives. And even if it was from my hive, I did exactly what I was supposed to do in that instance, requeen the hive, and they have been calm and normal ever since. It seems as if this was settled at the last hearing when it was determined that I was following the ordinance, but because she brought a lawyer, it forced this body to instigate a full-throated and invasive investigation into my beekeeping practices. In the decades since this ordinance's inception, this is the first license challenge. It is concerning that a single incident prompts an intrusive, taxpayer-funded review of a well-established regulation, forcing this body to go to Herculean efforts to satisfy Ms. Paleologos' vendetta. Despite the yellow jacket nest on Ms. Paleologos' property, the state beekeeper was still required to drive almost 4 hours to inspect my hive for this issue, and when he gave the hives a clean bill of health and stated that I was good at what I was doing, Nina forced the city to hire an entomologist who did the exact same inspection and came to the exact same conclusion, both at taxpayer expense. Having moved to Evanston just over a year ago, this ordeal has made me and my family feel unwelcome and embarrassed. It was mortifying at the last hearing that this waste of time was diverting discussion from crucial issues, such as raising the sub-minimum wage for restaurant workers. Unwarranted judgments of me circulated in the media, with my neighbor misrepresenting videos from my personal Instagram that were filmed months prior to our issue, taken completely out of context to fuel her campaign against me. It is petty, it is weird, and it is frankly creepy. I didn't ask for this. This is not how one wants to make the paper. This is my hobby that I have been doing for 7 years that I love. Furthermore, all of this does not reflect the community that I thought I was moving into. I truly hope that you will allow me to keep my license and prevent the misuse of privilege and taxpayer funds for personal grievances. Let us not allow this incident to define the character of our community. Thank you.
Thank you. And John Pivnat? Pivnat? Sorry.
Close. It's pure not.
Okay.
I'm the husband of a beekeeper and
Okay.
a little nervous, so apologies. I want to just say I moved from Chicago, so it's good to see, I moved to a city like Evanston because I knew they would take the matters that their citizens have in, dearer to them. And you've spent a really long time addressing someone's concern. It happens to be someone I don't agree with, but I do notice that and appreciate you all taking the time. I think things have gotten really out of hand in this instance. I think from my perspective, it seems like someone might have made a huge investment in a pool that maybe they're looking for some other reason other than themselves to not enjoy. And we are really just talking about one bee sting here, which I see happen away from our home frequently with even kids, and the issue is over with within an hour. So I'm shocked at how out of control this has gotten. But I think my wife has been very concerned about it. She's been thinking about it constantly. She's been doing her best efforts, and she's been doing a great job at it for 7 years, and I implore you to not take away her passion and hobby. So that's all.
Okay, thank you. And then we have some people online.
Yeah, we have some people who... Sorry. We have some people who signed the roster online, but I see one in person, and that's Pastor Monty Dillard.
Okay.
It is I in the flesh.
Okay.
Good evening to this wonderful committee. I'm Pastor Monte Dillard, Sr., and for the last 13 years, I've had the distinct honor of serving as a senior pastor of the First Church of God Christian Life Center, a church that has served this community for 113 years. I am here tonight to give my verbal approval and for the Pathways to Wellness, which I understand is to be presented tonight. There are two premier reasons why I'd like to strongly verbalize my support for this effort. The first one being that the individual, the visionary of sort, Natisha Waldron, her and her family have been a part of our church for more than 12 of my 13 years as pastor. She is a phenomenal character, has served in the highest levels of leadership in our church for many years. And my wife and I consider her family to be our friends as well. In addition to that, I have had the personal opportunity to view her expertise continue to increase in this particular field of wellness, seeing her doing it professionally at the highest levels, praying with her as she has continually increased in her knowledge and skill set as a career. And secondarily, I'd like to support it because when the EAT plan came out and the city sponsored its data walks, I had the distinct privilege of serving as ambassador for the data walks alongside Kristen Meyer. And it was a wonderful opportunity to get that information out to the city of Evanston. I believe we did a total of 6 or 7, one including a recorded one, which many of you may have viewed. And I think that Pathways to Wellness, this program that Natisha has been working with Ike and Health and Human Services on, is one of the ways that we can significantly contribute to solving some of the challenges that the EAT plan lifted. Thank you all so much for this opportunity to speak tonight. God's blessings to you and your families. And thank you for hearing me.
Yep, thank you. Anybody else?
Yes. Robin Nisi signed online. Is Robin Nisi available online? Okay. All right. She signed up for the online roster. All right. We have one more. We have one more.
Okay.
Deanna Gibson. Online.
Hello.
Hi.
I am here as a representative for also the program for Pathway to Wellness. I am a product of the program thus far. I stand by Natisha Waldron as she has dedicated herself to better not only women but men and to educate everyone in the community about wellness that is affecting the Fifth Ward. I wish that my desire is that this program will go forth, that we as a community need it, desperately need it. And like I said, I am a product of being part of her program thus far, and I am for the Pathway to Wellness. Thank you for allowing me to speak.
Thank you very much. Is that okay? That concludes public comment, and we can turn now to our agenda. Could I have a motion for HS1?
I move for the resolution 74R23, approval of an honorary street name sign designation.
I will second.
Thank you. And since I've made the request for this honorary street name sign designation, it's for Larry Suffredin, who recently retired after 20 years serving on the Cook County and Forest Preserve Commission. During his service, he sponsored a lot of different really important resolutions and laws. He helped codify county laws, saved the old county hospital building from demolition, created an independent health and hospital board, enacted an assault weapon ban, raised the minimum wage, created an independent inspector general, and created an eviction and mortgage foreclosure court protocol to protect people's homes. And then as a Forest Preserve Commissioner, most recently, he was very active and a great leader in sponsoring the successful tax referendum that is now providing much needed funds for our forest preserves. So I encourage the committee to vote yes for this honorary street name designation. Do we have a roll call, I think?
Councilmember Harris.
Aye.
Councilmember Harris.
Aye.
Councilmember Ravel.
Aye.
Councilmember Burns.
Aye.
Great. Thank you very much. And this will be, I think, on the agenda for December 11th. Is that correct?
Yes.
Okay, great. Thanks. Could we have a motion?
It's a big deal.
Well, yeah, it is. Yeah, we'll do a big applause at council, right? How about a motion to review the police complaints and comments report?
I move review of Evanston Police Complaints and Comments Report.
I second.
Okay, welcome.
Good evening, Madam Chair, committee members. Aaron Warnick, I'm a commander with Office of Professional Standards with Evanston Police Department. I'm here today to recommend that you accept and place on file we only have one complaint for today, the DI 2305, and then the comments report. Does anybody have any questions about the complaint?
Are there any questions or comments from anybody? I think it's all
Keep
very
doing your good work.
Yeah, all very
Appreciate it.
straightforward.
Thanks.
So,
Take care.
thank you.
Thank you.
So I guess can we do a voice vote on this one, Ike?
Yes, we can.
Okay. All in favor of accepting and placing on file this report, please say aye.
Aye.
Opposed, no. All right. And now we have the 2024 Human Services Committee meeting schedule in our packet. Could I have a motion to?
I move for adoption of the 2024 Human Services Committee meeting schedule.
I will second.
Thank you. So does that schedule look good to everybody, as far as you can tell?
Yeah,
It's a lot of meetings, right?
yeah.
Okay. Yes.
And they're all 5 o'clock p.m.?
I believe so.
Okay.
Is that hard for you to get?
Mm-hmm.
Because we could make them a little later.
Even if we did like a 5:15, I get stuck behind school buses coming from Des Plaines.
Right, yeah.
I would be open to having like a 5.
5:30.
5:15.
5:15.
Like
Yeah.
a 5:15, 5:30, yeah.
Okay.
Is that acceptable?
Would, procedurally,
it's-
would we have to make an amendment to the schedule, or?
Does the schedule actually give?
I don't
the-
think it has times.
I
right?
don't-
It does have time. It doesn't
Okay.
have times on it.
I didn't remember.
No,
the
it's
time.
just giving the date.
They're just given a date.
Yeah, I didn't remember seeing a time. That's
Okay.
why I'm asking.
Yeah.
If it creates hardship, I can just speed through all the different towns and break laws.
Yeah, speeding, right.
Just kidding.
Yeah, okay. Well, let's give that a try and see how that works.
Okay.
I appreciate that. Thank
Okay,
you.
then all in favor of the committee meeting schedule for 2024, please say aye.
With the 5:15 start.
With a 5:15
Yeah.
start?
That's
Well, just a point of correction. A number of times there are meetings that come before Human Services. For example, Rules Committee
Right.
might be scheduled at 4:30 or 5 o'clock, whereby the Human Services meeting would then be moved down to probably around 6.
6, right.
So there really isn't a schedule, so to speak, that is concrete at 5 p.m.
Okay.
So
Right.
it varies,
Yeah.
depending on
Yeah.
how many meetings we have.
Okay.
Yeah. Okay, so all in favor of the meeting schedule for 2024, please say aye.
Aye.
Opposed, no. All right. Now we get to
I will
our
move
beekeeper
HS4
Yeah.
beekeeper license complaint.
Second.
second. Okay. Discussion. Anybody want to? Yes, Councilmember Harris.
Oh, I thought Juan beat me to it.
Oh, okay, yeah. Councilmember Harakatis.
Okay. So I appreciate everyone coming. So in looking at this, you know, I think, me personally, I want us to do right by all our residents. I know for one family, it felt very invasive to have, you know, 2 experts come out, but honestly, there's no one up here on the dais who has that knowledge to make that call, which is, you know, something that I think we should probably think through in the future. Me personally, from where I sit, you know, I keep chickens. I don't know that much about bees, but animals are animals, so it's hard to tell. You know, you can't change behavior. They just do what they do. And so when you're keeping them, you try to do your best to, you know, promote the right behavior. And, you know, if it seems like when there was a problem, you folks addressed it. And based on what we have in my reading of the ordinance, I'm open to accepting the license. That being said, you know, I'd encourage you to, you know, do what you can to mitigate the effect on your neighbors. And if there's problems in the future, we would probably have to deny in the future. But I'm always willing to give people grace. And, you know, things are hard, you know, dealing with, you know, basically wild animals. So I'm going to vote yes tonight.
Thank you. And Councilmember Harris, sorry.
It's okay, thank you. And I appreciate everybody who came today. This is a microcosm of what Evanston is and how we have to figure things out. And I think both parties are trying to do that the best that they can. I think I am in favor of the license, but I am also in favor of working with the resident to move, to make some amendments. Everybody has to give. If we want, the only way everybody will ever be able to get what they want is for everybody to give in. As long as we both stand our ground, nobody will get to the middle, and that is where compromise happens. So I would like to work with, if that's individual, I know nothing about bees. You saw me try to kill the fly. I don't know if that's a bad thing. I am willing to sit with you all to help figure out a compromise that is equitable to both, because you both are important to our community, but we have to find a middle ground. And animals are animals. If you have children, they don't behave the way we raise them to behave as well. So we have to take all of those things into consideration. One bee sting is one bee sting too many. So I understand that, and especially to someone's eye. I can't imagine the pain that your sister endured, and I'm not trying to compromise that or belittle that in any form or fashion. But I would like for us to figure this out. So I'd be willing to work with both parties to figure out something that is comparable and that we can get. What is more important to me than animals, I have to be really honest, is humans. And there's a relationship here that is severed that needs to be mended some kind of way. And figuring that out, that's really important to me, is that our members and our neighbors have a relationship. We count on that. To be humans, we count on human interaction. So I will be voting yes for this, but with some plans on making this right.
Well, and one suggestion that was made by our entomologist was to move the hives further away from the one neighbor. So that would be at least one step that we would encourage you to do. Councilmember Burns? Oh, yes, good. You have your hand up. Go ahead.
Yeah, so that was going to be my comment. Is would love to hear a reaction to that recommendation to move the hive, because so that's one, and then two, I think just we need to review our ordinance and just to make sure that we feel comfortable with our process of how we want to kind of review and deal with complaints. I think the way we've handled this one makes sense. I know it was mentioned that, hiring an independent person to evaluate this with expertise was on the taxpayer dollar. Everything we do is on the taxpayer dollar to some extent, taxes, fees, fines, et cetera. It's how we, operate this government. I think for us, we want to make sure that we're spending it wisely and on the right things. And when there's a dispute, you need a neutral party to come in and evaluate the situation and provide us with recommendations. So I think this was money well spent if it is the Human Services Committee, responsibility to settle this dispute. I don't think it's unreasonable for us to request outside support to do this. If there's no dispute and y'all both came in today and said, "Hey, we figured it out," then yeah, we wouldn't have to go out and hire somebody. But because there was an ongoing dispute, there was disagreement on both sides. We felt the need to bring in someone an etymologist, and the recommendation that I see is not to not to deny the license, to approve the license, and again, there are some clear recommendations. So I'd love to get a response from the beekeeper about those recommendations.
Right. Yeah. So Ms. Nisi. So I think the main recommendation that I think we're all focusing on is moving the hives away.
Yeah, I mean, I there's not a lot of places in my yard they could go where where they're at is in the sunniest spot that they need a certain amount of sunshine in order to happen. But as you know, bees move. And so if I move the hive 4 feet, I mean, I don't know how much of a difference that can be. I mean, if we can find, I was very, in the lead up to this and the text messages we were exchanging, I was very, I was trying to work with her, but a sting, there's no way to prove it was my bee. There's no way to, and honestly, we don't even know if it was a bee. Yes, Brittany said that based on what Nina said, that it was a bee, but
Right.
we don't have the bee.
And that's okay. And that's okay. I think we've established that.
Yeah, and I also believe it was a yellow jacket. Anyway, because
Are you willing to, all I need to hear,
I'm willing to move it if we
Okay.
can find a place to move it to, but I also believe that, like, I mean, really the 5 feet in front of a hive is really the only part that's like filled with bees, and then they leave and then they go away. And so the issue that I will admit that I was unaware of was that I did have a water source in my backyard the entire time. It would be insane if I didn't have something. I just didn't have I got a bigger one that had like flowing water in it that I moved in between the hives and her pool to create a better diversion so that it would happen that way. That said, the water, I now know how to train the bees for next season to not go there. And so ideally next year we won't have the same issue. And I did keep the bees for 10 full months before anybody even knew I was having them. And I wasn't trying
before you talk down so we're going to move the hive is what I hear.
If we can, we got to do what's best for the bees too. I mean, I'm not going to put them in a shady spot just so I can say it was 3 feet away from where it was before.
So again, we're going to do our best to move this. We're going to work with the water supply.
Water supplies, they're there. The water supplies have always been there.
Okay. Because I think what we're asking for is reasonable. Mm-hmm. And we know it can happen again. But if you've done your part, that's all you can do. We're never responsible for other things. So if we can do our part, then I think that makes us feel comfortable up here.
And I'm always, I mean, even when I don't even think that, when she notified me on the 23rd, I had requeened by the 25th. It's not easy to find queens. So I worked quickly to try to solve these problems. So, you know, I am always willing to do what's right. And I think I was very flexible leading up to this until, you know, it turned nuclear. So there you go.
Director Ogbo, do you want to talk about, you know, next steps?
Yeah, absolutely. In an email sent to me by the entomologist, she specifically indicated a location for the bees come April, when bees are more active, and she indicated that hives would need to be, and this is a compromise based on her statement, could be relocated across the yard closer to the house on the other corner of the fenced-in backyard. And her recommendation is for this to happen in April when the bees become more active again. So, and this is an email I received from the entomologist. So there is a location specified by the entomologist, as indicated. Let me read it again. Across the yard closer to the house on the other corner of the fenced-in backyard.
So we should be able to send that to her and then inspect in April that happened.
Right. So, Ms. Nisi, are you saying that that's a shady spot, or?
Should I? I mean, it's.
Yeah, just one. Sorry.
I mean, it would put the bees basically in the middle of my backyard. And so it would, I mean, it's not good for, I don't think it would be good for the bees, and I don't think it would be good for my family to have the hive right in the middle, because right now they're in the back of my property, so the bees have a line to like, in fact, it might actually make things worse, because that'll make the bee line go directly over her pool, because that they go, you know, like the way out, and that would make them face her pool, so it probably would make things worse. But you know,
isn't that an expert? Is that
I'm friends with her, so I'm going to ask her about that and see if that's exactly where she. I mean, I think she was just coming up with anything so that there would be some element of compromise, because everything was going in my way. I think she was trying to throw a bone at the situation to try to find something to have compromise. And I'm all about compromise. My whole life is compromise. I'm used to this, but you know. But I will. I mean, I will work with Brittany. I mean, we've been friends for years. She's beekeepers. We all know each other. Mm-hmm. And so if we can do it that way, I am not a stick in the mud, but I also don't want to put a beehive in the middle of my backyard if it can be avoided.
Right.
Well, we're going to trust the experts. I mean, and I'm not saying you're not an expert, but the paid experts who don't play it on TV. And we're going to figure this out. So, again, there's got to be some compromise. We don't want to deal with this again. And it isn't because of financial or any other reasons. We want the community to get along. What I'm seeing is this also human nature getting bigger, and other people are involved, and other people are involved. We got to get this together. And I'd like to end this now and work with this.
Right.
If Brittany sends us something different, or Miss Brittany sends us something different, we can work with that. But what we have right now is what's been presented.
So I think what we're saying is perhaps, Director Ogbo, you'll follow up in April to see what adjustments have been made and to report back to us at that point.
Yes.
Okay, so I think the committee is ready to vote on approving the license. Do you want to take a roll call on that, please?
And
Whoops. Yes.
Chair Revelle, if I can say one
Yes,
last
please, go
thing. I just want to make sure, because it seems like there's still some ambiguity as to where the hives can be relocated to.
Right.
And so I think it would be helpful, even if just in between meetings, we can get an email from Brittany.
So now you're trying, so now you know.
After she's talked to the beekeeper, to understand exactly what they've come up with and where they feel is the best place for the hive to be located. So I just wanted to, it sounds like that's what's happening, but I just want to make sure.
Mm-hmm. Okay.
Sounds good.
Yep, so Director Ogbo will follow up.
All right.
Okay, roll call.
Councilmember Heracott.
One quick thing.
Sure.
And also, just for the two residents that are here, the city has mediation services. So I've, put residents in touch with them, and, and sat in on those sessions before, and it is a good way to get to, a place of understanding between the two parties. So if you guys are amenable to that, I think that'd be great.
Yep, thanks for that suggestion.
All right. Councilmember Heracott.
Aye.
Councilmember Revelle.
Aye.
Councilmember Burns.
Aye.
And Councilmember Harris.
Aye.
Okay, so the motion passes and the license has been issued, and we'll be following up in the months to come. Now we're going to be talking about our city council goals, particularly the goals under public health. And I think the goal is public health, but what we're coming up with are some measurable objectives. And I did come up with a sort of a draft of some suggestions.
Okay.
So why don't
Do we need to move it for action?
Yes,
or-
please.
I will move item HS5, City Council Goals, Public Health.
Great, thank you. So I came up with four, using the items in our memo from Director Ogbo. I looked for which ones we could actually put some measurable targets onto. So I came up with four. Implement a second guaranteed income cycle in 2024, 2025. And I have a question about, do we have a budget for that? Reduce citywide smoking by a certain percent by 2025. Reduce levels of obesity, high blood pressure, diabetes, and asthma in Evanston with pathways to wellness participants by X% by 2025, and then provide mental health first aid training to some number of community members in 2024. That's one of the participatory budgeting programs. So you see, I've left a lot of blanks in there, but those were otherwise we can't really measure how well we're doing on meeting our goals. So I throw it open to the committee for some comments.
I'm trying to get my computer to log on because I had notes, so
Okay, yeah.
keep going.
Can I speak to?
Sure, yes, please go ahead.
Absolutely. And thank you for providing your input. It's very valuable. The way that the memo is designed, it pretty much highlights a number of initiatives that we want to implement, or initiatives that have been implemented already. And the direction is, of course, to have matrix behind these items that are listed, whether that means the number of individuals whom we've attended to, or any other matrix that are necessary to measure health outcomes in regards to these activities that are mentioned. Even though not mentioned that how we're going to measure that matrix, but internally, that's what we plan on doing. So the memo in front of you pretty much provides a broad direction of where we are going, minus the matrix, which, as I mentioned, it is something that we will be working on internally. And I also appreciate that you provided the dates as well, given that these council goals are from 2023, 2025, and our E-plan actually expires in 2026, and these public health goals we think are achievable within 2024 and 2025. So thank you.
So do you, so I guess what are you suggesting?
Well, at this point, I think perhaps revising it and simply adding the dates to it by which we plan to accomplish a number of these items. And if you look at the items, we do have a number of them that have been accomplished to a certain degree. For example, under advancing health equity, we highlighted workforce development. This year, we expanded our workforce development efforts by adding more staff and more activities and programs, Aspire being one of them, Emerge being one of them, and other programs that we are facilitating. So that will also be measured by the number of individuals whom we've positively impacted, or individuals who have enrolled in those courses, or individuals whom we have connected to internships, jobs, careers, and you name it.
So my Councilmember Heracades.
Actually, Councilmember Burns had his hand up
Oops,
before I did so.
Okay, Councilmember Burns.
Yeah, thank you. And, I think it's hard to do this, but when we're able to, I think it gets more at what we would, I think it gets more at what we should be doing is measuring kind of public health outcomes as opposed to how many people participate in any given program. That's one way to do it. We could say, look, we want, this many people to sign up for this program. But ultimately, as a city with a public health department, I think we need to be tracking health outcomes. And I know that's difficult to do. Some of it, is easier to track over longer periods of time than shorter periods of time. But I'd like to at least I want to make sure there's some effort put into tracking health outcomes so that we're not just making these investments in various programs, but that we know what difference we're making in terms of health outcomes. So, for example, what is guaranteed income fundamentally about? Is it? I'm sure there are several metrics we can track, but can we track, eviction, rates of people who participate in the program over a period of time? Because we know, the less money you spend on housing, the more stable you are, right, in terms of your housing. So Director Oglebay, sounds like you're going to be doing that work, but I just want to be clear. I think what the direction that we provided as part of our priorities and goal setting council meeting that we had was to send this back to various committees to send each goal back to each kind of relevant committee and say, look, help us come up with numbers, metrics to know when something is successful. And so I think we have to figure out how we get there. And Director Oglebay, I think you said that your team is going to be working on that and maybe prepared at the next meeting to come back with some recommendations. But I just wanted to center that. And that's all, Chair. Thank you.
Yeah, absolutely. It is something that we're going to be working on internally in regards to matrix. For example, guaranteed income, we're hoping that that will come back for a second cycle because to a high degree, we believe that that was a positive impact in our participants. But we are formulating it differently this time, at least that's the proposal for families where they have children 5 years or younger in the census tract 8092, which is the most impacted or vulnerable census tract that we have. And one matrix that I'm thinking about is housing stability through guaranteed income. There's a way in which we can measure that. We're looking at citywide smoking and reduction in our smoking rates here in Evanston, and that's data that we can definitely track through a number of agencies, for example, peer services, to see how well we're doing. I know we've had robust conversations and passionate conversations about the recent flavor tobacco ban, and I think that will aid in our efforts. So there are ways in which we can gather data and measure it. For us who've taken the liberty to read our e-plan, it's pretty much full of data and how we can certainly measure it and how we were able to obtain the data, and that will also be applicable in these measures here. But this memo just pretty much summarizes it, but it doesn't provide the detail as to how these will be measured. So maybe during the next meeting I can provide some matrix on how these items will be measured.
Mm-hmm. Yep.
Yeah, just to finish up my comments, I think that would be great. Especially again because the specific kind of requests from council at our priorities and goal setting meeting was to do just that, to come back. We've adopted goals, kind of broad goals, but now we want to add metrics to each one. So I think that'd be great if the chair agrees, if we could get those recommendations at the next meeting.
Right. Yeah. I do think that's the right direction. Councilmember Director Ugbo, go ahead.
What is the time limit are we looking at this? My understanding is that we want these approved before the year expires. So I'm just wondering how much time we have.
That's the problem. I mean, I think we're supposed to be reporting back to council.
Yeah, in December, I believe. In
December, right. So.
I mean, personally, I think it needs to be done and done right. So whenever it's ready, it's ready. I think it's possible that some goals will have metrics before others. If you're able to get this in even before our next meeting, I think that's fine too. I don't think it necessarily needs to come back to this committee. We could discuss it tonight, and then you can send your recommendations directly to council.
We can try that.
Yeah, we can certainly do that.
Right, and then the committee can still discuss it later as well. So, yeah. Councilmember Harris, do you have you're okay with that plan? And Councilmember Harris?
Yeah, and Councilmember Burns touched upon one of the things I was going to talk about is the data part. Mm-hmm. And when looking at all these goals, there's not one metric for all the goals. So it's going to be a really complicated, there's not one place where you can just grab all this data. So I think the importance of benchmarking, and then my ask would be as these programs roll out, having, a public dashboard so that, we can easily point people to what's happening. Because I think there's a lot of things that, because I know we got reports on the workforce development and the numbers that we got back, and it's really good work. And it'd be really important to show that, positive work to the public. So a public dashboard would be fantastic.
Right.
Okay, great.
Sounds good. And not only that, I think that's actually a great idea, a dashboard. My thought is also to provide a report so often to the Human Services Committee regarding these measures and matrix and seeing how we are progressing and hopefully not regressing, but a progress report on these items.
Yeah, right. No, that's the benefit of having measurable goals. We can report and see how we're doing. Okay. Then I guess we're what are we doing here? We're approving, we're giving you direction, I guess. Yeah, okay, thanks. So do we have to actually vote on something? Okay. Vote on the direction that we're giving to Director Ogbo.
Yes. Which is to amend the goals by incorporating health outcomes and matrix.
Yeah, measurable outcomes.
Outcomes,
right,
yeah,
yes.
okay.
Right, okay. So should we do a roll call?
Yes. Councilmember Burns?
Aye.
Councilmember Harris?
Aye.
Councilmember Ravel?
Aye.
And Councilmember Harris?
Aye.
Great, okay, thank you. And we'll look forward to seeing that when it comes to council. So now we're ready for, I think, an item that a lot of people are here to talk about. Would someone make a motion for HS6?
I move for the discussion of approving a 2-year health initiative, Evanston Pathway to Wellness.
I second.
Great, thank you. So who should we let Councilmember Burns go first on this, or Director
Councilmember Burns,
Ogbo?
you want to go first on this to introduce it?
Yeah, I'll be quick because I want Director Ogbo to also introduce it and as well as our guests this evening. But we've been working for a while. Director Ogbo and I, Natisha, Sarah Flax, Director Flax has also participated. Credit to career to some degree, and others have been working, I think, for well over a year now on this. There's been a lot of time and effort that's gone into this, and I think what brought us all together is that we wanted to make sure that there was an adequate response to the sobering data that was presented in the E-Plan. Time and time again, whether it was life expectancy, chronic illnesses, no matter what it was, 8092 kept coming up. 8092 census tract, 8092 census tract. And for those who are unaware, a large part of the Fifth Ward makes up the 8092 census tract entirely. And so anytime you hear 8092 census tract, understand that within that context, you're talking about the Fifth Ward west of Green Bay Road. And so, and obviously as a council member that represents this area and that grew up in Evanston and whose friends and associates kind of make up this data, this was really disheartening. And I think what brought us together is that we wanted to make sure that there was a response that met the need. And we haven't really, outside of guaranteed income program, we haven't really dedicated any federal ARPA money towards improving public health in Evanston, and which is why, we dedicated the time necessary to come up with what we feel is an appropriate response that's going to make a difference and ultimately extend lives and allow people to spend more time with family and live and feel and be healthier while they're here. So, on that, I'll Director Ogbo, if you want to say any other words that you would like, and then if you want to introduce our guests for this evening.
No, I think you hit the nail right on its head. This is an item that we have been working on for many months, and I am delighted that we are going to present it tonight. We do see the intent, the value in the program, and the goals that we are looking to achieve. For right now, it is a 2-year pilot, and I know there have been some questions as to the sustainability of the program, and I believe that once we see the value in the program, there will be ways in which this program can continue, maybe as it is, or improving what we have, or adding other elements to it. So We're going to have the presentation by Natisha Waldron. And Natisha, if you can introduce yourself, I think that would be awesome. I think the presentation is already online. Let me see.
Well, good evening.
Good evening.
I actually don't even need that yet, but probably the last 3 minutes, I'll need those slides. Well, thank you guys for your time this evening and hearing from us. It's a pleasure to be before you tonight. So I kind of wrote down what I want to say because I think it's important to hit all of these particular points in your hearing today. So on February 17, 2023, my mother called me from the emergency room and said that she was having terrible stomach pain. Hours later, she would have emergency surgery, and the next day, a massive stroke. This is the beginning of an ordeal that is still ongoing. My grandmother, her mother, was too ill at the time to go and even visit her in the hospital because she was debilitated due to diabetes. Dr. Kim's one of my colleagues. Her mom and her father both passed due to heart-related illnesses at a very early age. I actually had the privilege of speaking at Kim's father's funeral, and we grieved and we processed that pain together. 773-989-7277 is the phone number of my late grandmother on my father's side. She had a massive heart attack 2 days prior to her 60th birthday. Dr. Kang, another one of my colleagues that is assisting with this program, was motivated after her own father experienced a stroke, and so she developed software to monitor his conditions and change the trajectory of his life. So we actually live this. Emergency care is statistically the only form of care provided to a large portion of BIPOC citizens, which is Black, Indigenous, and people of color. Often, due to the time constraints, trust issues, or lack of resources available in that community, there are very commonly many stories of early demise and less stories of 90th birthday parties than which we experience with our more prioritized neighbors. I'm comparing Census Tract 8092 to some of the more privileged communities here in Evanston. So what this means is there is a gaping absence in life expectancy, primary care and patient relationships that sustain life. They prevent illness and they treat diseases before the prognosis is so bad that nothing can be done but to keep people comfortable. Very often, people prioritize the care of their homes and their families over self-care and health care. This is not a preferable state by any means, but unfortunately for decades and now even centuries, it's a continual cultural condition and a cultural norm for many of us. It means that we are choosing survival over our health. As depicted in the E-Plan results of 2021, this is evident and prevalent that also in Evanston's Black and Brown and BIPOC communities, the E-Plan collected a series of data points that showed a higher prevalence of disease, higher prevalence of depression, lower income, lower education, and shorter lifespan. So we as a city, we stood together, we trembled in the face of our underbelly, and we examined our policies and our practices, and we realized that they were due to unfair redlining. We also boldly got together and we passed reparations. Things that we should all be proud of. These are very progressive matters. We got together, we did a data walk, we shared information, but it's seemingly that we have stopped. Evanston, under the leadership of Alderman Robin Ruth Simmons at the time, we addressed slavery and we addressed the Pan-American slave trade and the impact on our community. And so we should be proud of that. But we also can't afford to stop or to keep this pace of practicality, or we will continue to lose ground. I personally belong to Evanston. All my real adult life has been spent here. All my babies were born right at that hospital. I work, I worship, and I serve here. I am a Minister Natisha Waldron. I am a mother, a healthcare administrator for over 15 years, a public author, a fitness instructor, and an entrepreneur. On my team are 2 clinical nurses, one a PhD and an LPN, who both operate and own agencies that prioritize the underserved. I also work with 6 certified fitness instructors and 2 of them are medical billing specialists. We have a certified nutritionist and a clinical social work, a master's in social work. So what we lack in experience on this team, we share an overcompensation ability because of our proud partnership with Erie Healthcare and other prestigious organizations in the community. So what I've just described to you today is over 100 years of combined healthcare experience in all areas. We see the statistics. We live the statistics. We are committed in our life's work to help healing them. And so, unfortunately, we feel them personally. So I shared our credentials to say that we are qualified to lead this work. We have developed a comprehensive and practical solution-oriented framework to reverse the impact on our BIPOC communities that Red Lines have drawn through our community's health and life expectancy, as we know that we have, that there is a decline of 13 years, The City of Evanston is proud to introduce a dynamic program, Pathways to Wellness, that supports and improves the health of its most vulnerable citizens. In response to the E-Plan data, which identified a negative impact due to historical redlinings on Census Tracts 80, 92, and 95, the City of Evanston, in partnership with Whole Woman Fitness, has designed a solution-oriented program. The objectives of the program are to treat and address chronic illness. This program will combine fitness, wellness, medicine, technology, and re-education to treat members of the community who suffer from chronic illness. The objectives include: we will utilize a remote patient monitoring technology to treat, track, and re-educate on chronic illness. We will deepen or develop patient to primary care relationship, also by using our nurses for advocacy. We will address healthy food insecurities with a monthly stipend. We will address medication negligence and reduce trips to the ER. We also offer appointment reminders and advocacy to help with preventative care. And this program will include daily or bi-daily biometric reading, depending on the needs of the individual. Low to no cost in-person and remote fitness classes. Provides re-education courses for meal prep, disease management, mental health, and wellness, and financial literacy. And we have medical alerts for patients who fall below the norms. We provide free equipment for chronic illness management, diabetes, hypertension, obesity, asthma, depression, etc. We collect and track several points of clinical data and its progression, utilize local business and community partnerships, and improve the overall health of the compliant participants. We intend to work closely to close the life expectancy gap, provide accountability by demographically focused small groups, and utilizing existing city services. So as I conclude, we are not asking you to release funds to do this program, but we are asking you to sow seeds and partner with us. And the program is long-standing and self-sustaining. One of the benefits of remote patient monitoring is it's already proven to work. I actually personally worked on this program for the Cook County Healthcare Administration, where we serviced over 5,000 individuals at one time. So this is a proven work, but what I was able to identify is some gaps. The community was absent from it, so there was a lower compliance. And so this program has answered to that by being comprehensive. So my final thoughts as I close is that I'm sure if I ask everyone in this room, will they desire to live an additional quality 13 years, that no one would say no. So to our faith community, it takes more than prayer. To our political community, it takes more than acknowledgement. And to our medical community, it takes more than medicine. So Evanston community, I believe that we collectively have what it takes. Let's get behind this initiative and provide an equal life experience to all. We all deserve to have 90th birthday parties. So thank you so much. Last thing I want to do is to share some slides with you. I have my colleague, Dr. Kang, on the line. She's available via Zoom, and what she's going to do is just show a couple small components about the remote patient monitoring program and the application that we will be using to support and manage and monitor our patients.
Great, thanks.
Dr. Kang.
she's on the Zoom, correct?
Yes, I saw her
I
up
saw her
there.
name earlier, yeah.
She said, can you guys unmute her?
Ooh,
That's Anderson. All right. Got it.
It's under Kang.
yeah.
I just asked her to unmute. I think she's unmuted now.
Okay. Hi, everybody. Sorry, I was trying to unmute myself, and I really appreciate everybody's time. And so we're a technology partner to Natasha in this initiative for supporting the medically underserved population to help improve their recovery outcomes, health outcomes. And just to give a quick introduction over our background, as Natasha mentioned, is that I did my PhD in medical training at Johns Hopkins Medicine. And the reason we founded the company Kangaroo Health was out of my father's personal care journey, where he has poor recovery outcomes and complications and lead to bad outcomes because of lack of care at home. And that's why Kangaroo Health was born in 2015, which is 9 years ago, to really support patients and patients' family members to achieve better health outcomes at home through smart technology. If we can go to next slide, please. Is there a way I can move the slide further? So can we go to the next slide, please?
1 second, they're working on it.
We're trying to figure that out.
Okay, sorry. Because I don't see the other side.
Yeah, I know I was given permissions to operate, muting, unmuting, et cetera, but I don't think I have the ability to operate the slide.
Just a minute, we're going to go see if we can get some tech support.
Okay, yeah. So while we're
She's
waiting,
gonna-
I'll just think.
Go ahead, Dr. Kang.
Okay, thank you, Natasha. So while we're waiting, I think we can continue to give a further introduction just to save everybody's time as well. So our company was founded in 2015. So we have been almost 9 years and in operation serving over 10,000 chronic ill patients all over the country. And a significant portion of those are medically underserved patient population and who have lack of access in care and so forth, or their home is far away from necessary care. So that remote patient monitoring has played a critical role to reduce their ED visit readmission and reduce their chance of escalation to help them to cultivate healthy habits as well. And then in terms of Kangaroo Health side, really as Natasha mentioned, is that CMS has done 3-year clinical study with over 400,000 patients and showed overwhelmingly positive results that remote patient monitoring effectively reduce ED visit readmissions by from 30 to 80%, reduce a mortality rate by up to 50%, reduce a different like length of stay in the hospitals, like an intensive unit and so forth, from 30% to 50% in different clinical studies. And that's why in 2020, CMS actually issued additional reimbursement codes category for remote patient monitoring. Of course, this is like outside this, like the outside the kind of the pricing for this, the billing for this programs. But what I'm trying to say is that the CMS really stand behind the technology and show the clinical impact before they put in like funds to support this on their side.
Dr. Kang, quickly, you should have the ability now to share your screen if you're at a device where you can do that. So I don't know if you want to try to share your screen.
Okay, awesome. I can do it now. That'll be
Okay.
perfect. Awesome. Just give me a second here. Just want to make sure you can see. Can you see my screen?
Yes. Yeah, you may want to, yep, I was just going to say, you may want to enlarge it. That's perfect. Thank you.
Thank you so much.
We can't in the chambers. We can't see it.
Oh, I think someone, something disabled the screen sharing. Oh, no, let me try again. Okay, let me try again. I think just trying to play with the tech. Okay, can you see it now?
No. We only see our lead computer.
Yeah, we can see it online, but for whatever reason, you can't
Yeah,
see
we're
it in
stuck
person.
on that. Yeah, we're stuck on the first slide. Can somebody just send it to us?
Yeah, I can
The,
send it.
maybe whoever's sharing the screen, they stop sharing and then allow me to share on my end. Will that work?
They're in a different place. We're trying
Oh,
to
okay.
fix, just for the sake of time.
Yeah,
I
if you
think,
could you send this around, maybe to Natisha or
I have
myself?
it.
And
Who
then
am I
can-
sending it to?
If you could send it to Ike, Director Ogbo, and then
He's-
Director
he
Ogbo, if you
has
could
it.
send it to all of us.
okay, I was gonna
Okay,
say, or
yeah.
can you send it,
Director
Bobby?
Ogbo,
He's
wanna-
not in the room with us right now, so if you want us to look at it right now, he's not in the room.
Yeah, if you, Natisha, if you
Councilmember
send it to
Burns.
me, I can
Yeah.
forward it to everybody.
Thank you.
If we can hang tight for a second, we'll get that disseminated, and then we'll continue, Dr. Kang, in a moment. Thank you.
Okay, thank you so much.
Thank you. All right, it's been sent.
Okay, I'm looking now. Yep, I'm gonna forward it now. Forward. All right, it's sent. You should have it momentarily.
Okay, so then should I reshare my screen?
Yes, for the Zoom members.
Yeah, Yep, exactly. We have quite a few people online, so that worked.
Awesome. So thank you so much. So as just a quick recap, as we mentioned, is that we have been in business for the last 9 years and building a really well-established remote patient monitoring platform, serving over 10,000 chronic ill patients, with a lot of them, significant portion in very similar patient profile to the medically underserved population that we're in discussion right now. So we have a lot of experience in this field. And we're women-owned, minority-owned business as well, and in full partnerships with Natasha to support this initiative. And as I mentioned, CMS has done 3-year clinical study with over 400,000 patients across the nation to validate the results, to validate the impact of remote patient monitoring. So much so that because it's showing overwhelming results in terms of effective reduction in readmission, ED visit, and so forth, they put reimbursement codes behind this category in 2020. And then remote patient monitoring technology itself is actually very easy for a patient to get into. There's no learning curve. So imagine there's a patient, the patient's enrolled into the programs. Then we give patients FDA-approved connected device sent to the patient's home directly. So this way, as you see in the middle of the screen, it says connected monitoring device. These devices are 4G powered, meaning there's no dependency on the patient users, whether they don't need to have a smartphone, they don't need to have Wi-Fi, they don't need to have internet at home, they don't need to set up anything. So it's really, they open the box, the device works on its own using its built-in SIM card and 4G network. So that's the convenience and ease of use we built in to especially support the chronic ill patients and geriatric population, medically underserved population. And like also that if the patients, like say they have a smartphone, they're given a smartphone and so forth, then they can download a patient app by themselves where their family members help. And then they can see their progress over time, communicate with the care team, with the fitness team, with the cooking teams that Natasha put together. So the systems really support the patients, not only from one-dimensional data tracking, but also we give patients educational content supported through the app to show patients how to really maintain their blood glucose levels and or reduce their blood glucose levels, reduce their blood pressure. Through these digital like nudges, health tips, and so forth, we are really building the patients towards a healthy trajectory, like building a health habit for the patients gradually. And what the system does is that it's smart itself. So whenever the patient data come in from a patient doing a measurement, the results are automatically analyzed in real time by the care teams, by the software system. And the software system will generate alerts to Natasha's care teams so they can, like the nurses and care team, can immediately follow with the patient and triage the patient to the next level care. And the value here is that we're discovering the early warning signs. So the patients are not to the level to need an ED visit, readmission, so forth. Through early intervention, early symptom discovery, we're able to like change the patient trajectory. So preventing them from escalating into the severe adverse event, ED visit, readmission, so forth. So that's the value really. We're helping patients to become their partner in their chronic condition management and build health habits to achieve better outcomes. And then this is one of the many hundreds of clinical study out there through a randomized controlled clinical trials for over a year, treating like patients with cardiovascular conditions. And these are the results from a publication just showing like reduction in the most difficult, most high-risk patient population that has still achieved significant reduction in readmission, mortality rate, ED visit, and length of stay. And also one of the things we fully understand, we support many different conditions for the patients. So we're not tracking patient using one-dimensional conditions. And then we operate as a turnkey solution. So we provide the whole monitoring, the whole platform, the devices, everything is HIPAA compliant. And all of the data is hosted in a HIPAA compliant server online and is encrypted at rest and transit. So that's remote patient monitoring technology in a nutshell, and we'd love to be a partner in this journey together.
Great, thank you very much.
Well, thank you guys for your time. I can take any questions if you have.
Sure, yeah. So committee members, any comments or questions?
Yeah, I had a couple. Thank you so much. Very intriguing. We met through Evanston Own It as well. So I'll go backwards. I looked and it talked about equipment that we would be providing residents. How do we ensure that, do they get to keep this equipment? Is it not, kind of multi-pronged question, is it worthy to have them get a membership where they don't have to be dealing with equipment of dumbbells and stuff?
So what we've done is the equipment that you're referring to for the remote patient monitoring, which actually monitors disease. So let's say, for instance, if someone had high blood pressure, we would mail them a blood pressure clip.
There was dumbbells and all of that.
Oh, equipment for the
working
fitness,
out
for the fitness
Yes,
classes.
I'm sorry.
Yes, so basically, a lot of those equipment fees are just to establish the program for the large amount of individuals that need to come. So once they're in place, they're in place. They are not for individuals to take home, but to be utilizing the facilities.
Gotcha. Okay, thank you. That's what I was kind of like. And then I saw facility storage, and I just didn't know if the city had some place where we wouldn't pay.
Everything that the city can assist with taking on, we would be happy to not spend money on it.
Okay.
Yes, ma'am.
So that's something we'd have to look into. Then I was wondering about the food vouchers. Are they to specific places? How is that monitored? If you give me a food voucher, I'm buying junk.
For sure.
Honestly, I'm just honest.
So, Director Ike, you want to answer that?
Yeah.
Okay.
We arrived at the food voucher, and if you look at the the food expense. It is only for a year because we are looking to reduce cost. What we're planning on doing is issuing debit cards. We do have a program that is embedded in our human services section of the department where we can monitor usage and we can restrict what those cards are used for. So our plan is for the cards to be used for healthy meals, and we're looking to select a number of restaurants that qualify or can provide such healthy meals to our community participants.
Okay, thank you. And then my last question, this is expensive. And I already reached over like, okay, do we have almost $900,000 to do this for 150 people? And that's directed more this way than that way.
Understood. And if I can speak to that. So redlining is expensive, right? Some of the things and some of the conditions that our community is in, it will take a financial investment, a substantial financial investment to begin to work out of. But what this is not a total investment, it's a partnership. It's to build a foundation for many more. The program has the ability to sustain thousands of people. What we're doing is we're piloting 150 people in Evanston to ensure that they have wraparound services of every kind. By no means would the program stop with this close to $900,000 investment. What it does is it puts foundational things in place so that the program can continue. What makes the program sustainable and so to speak is basically the way that it would work is only the individuals that are uninsured would need to be applied towards the grant. Individuals with insurance, many of these services, as Dr. Kang explained, are billable by insurance. So ultimately what we'll be doing, because this is a community service project, is the people that are uninsured would ultimately in the future be helping to support the people that are uninsured. So we are only applying people that need the grant to the grant. So it can stay open beyond this 150 individuals for the long run. But because many of the services are billable, most of us don't utilize the benefits of our insurance plans as it is. We will be able to continue to self-sustain by obtaining those funds for people that are able to have billable insurance.
So with that number, we're believing the 75 a year will be uninsured? Is that what I'm hearing?
The funds are set aside for the uninsured.
So, and it's just me, I'm just trying to understand. So we have the capacity and we will potentially do more than 150.
We have the capacity to do it, absolutely.
Okay.
And we can absolutely support more than 150 individuals.
With this funding? Now,
yes, ma'am.
Okay. So I'd like to see that be part of the pilot to see how do people who have insurance versus those who don't be part of that kind of, I can't think what you call it now, but the
control group?
Yeah, the control, we give some people sugar and some people the medicine. So yes, I'd like to see that, and maybe I just didn't catch it fleshed out a little more. The 150 did scare me for that number.
Yes.
The numbers, while, yes, redlining costs, disparity has been a cost and will continue if we don't fix it. We're in a tight budget crunch right now, and I have to be able to explain to 78,000 people why we approve something at $900,000, or I'm sorry, I'm making up numbers and I'm tired.
You're almost there.
Close enough. So the numbers have to make sense at some point, especially now. So I wanted to make sure we had that money. I'd like to see that pool be bigger, but I do want it to be a controlled group. So those were my questions for now. Thank you so much.
No problem. My pleasure.
Councilmember Heracles.
I just wanted to comment real quick and thank Councilmember Burns on his hard work on this. He meets, just so the public knows, every week working on this. I have been, able to hop on the call a few times. But yeah, this is like a big job, and I appreciate the work he's putting in. I also appreciate the fact that through the ARPA funding, we're using something to like directly impact people's health, which I think, we've spent money in many different ways, but I think this is a worthwhile goal to, help the community. So,
Thank you. And speaking for myself, I remember going to one of the data walks and learning in depth about the E-Plan and the really dramatic disparities, and wondering what on earth were we going to be able to do to try to start addressing those disparities. So I too appreciate Councilmember Burns really digging in and coming up with a plan to address those disparities and make a real difference. And I think what we're also looking at is creating a foundation or a platform to be able to help many more people than the 150 that are part of the initial program. So I have a question now about, so we council have already approved the funding. We've already allocated the ARPA money for this, right?
I think Councilmember Burns can.
It was item D.
I think Councilmember Burns can chime in. My understanding is that most of the ARPA funds have been expended, and there is a portion that is still available with a number of other initiatives competing for for the funds that we still have available. I'm not sure the amount that is left at this point, but there is some money that is available that is that are not allocated at this point.
Okay.
So I have those numbers. I can jump in. So there is $1,039,642 that are unallocated, and then just recently in our housing community development meeting, we closed the small rental owner assistance program, and there's an additional $375,998.25 that is unspent from that. So roughly 1.4 million, just under.
Yep. And thank you very much. That's helpful. Yeah, Councilmember Harris, you look like you were about to.
Well, I just saw somebody from participatory budgeting, but I didn't know if they were going to be able to speak to that. But I guess Councilmember Harris got us the information.
Yeah.
Thank you.
So
yeah, my hand's up if I can be acknowledged at some point. I don't see the hand.
Go ahead. Councilmember.
Yeah, I was going to say the last time I checked, I actually thought we were at 1.5 million. And so I think it would be helpful to just double check with Director Flax and her team. So I think we need to understand where we're at. The only other proposal that I'm aware of is the guaranteed income program, which I think Northwestern has at least said that they're willing to have a discussion about how they can support, or the trustees can support that program. But that's the only other initiative that I'm aware of at this point. And again, this program was in some sense set aside. The funding was the funding was in previous discussions we've had. This proposal has come up before, and at a much higher dollar amount. I think at one point the request was at 1.5, and then we went back to the drawing board and figured out a way to get it down to 800,000. And as Letitia said, there's the ability to serve even more than the 150 in the pilot program once we're finished. Because the other thing about this is we don't want to rush into serving too many people, in my opinion, before we understand kind of how to do this well. And so that's the importance. Although I think it is guaranteed that there'll be money left over, I don't think we should rush to insert new people into the cohort until the first, pilot program has closed, we can look through the data, understand what we've learned. We haven't talked about the advisory board at all. I'll let Director Ogbo talk about that, but we have partners from Erie Family Health Center and Northwestern Medicine and other places that have agreed to work with us on this. I think we need to sit down with them periodically throughout the process, but also at the end to just understand what we've learned and what the next steps are before we rush to enroll new people into a program. But also just want to emphasize that I think, Natisha, correct me if I'm wrong, but the way it works is the funding, some of the funding would need to be spent up front, even for people who are insured, but then the money could be reimbursed. So, and that's the question, I guess. I just want to make sure I understand that correctly, Natisha. So go ahead.
Many of the services are billed by insurance. So the upfront cost would be the foundation of like materials and things that are needed to establish the program so that people can come into one space and benefit from it. Other than that, the devices are billable to insurance. The platform usage is billable to insurance. The utilization of clinical staff is billable to insurance. And these programs are already supported and approved with Medicare coding, which in turn makes it approved by commercial insurances. So yes, there is some upfront cost that will not change. And the reimbursement does come on the back end of insurance. Insurances kind of pay when they want to.
And that was my point. I just didn't want to, I want to make sure that we're being clear on what people can expect. I just, but in some cases, we may have to pay for something up front, but then it would be reimbursed on the back end, right? Or is that not the case?
That is absolutely correct.
Okay. And I think that's fine. I just want to be clear that the money is reimbursable, similar to some of our other programs in Evanston. I think about even the storefront modernization program in Evanston works in that way where, the money is spent and then we reimburse on the back end. So that was one. And then, and two, I think, again, Director Ogbo, well, before I finish my statement, Director Ogbo, can you talk a little bit about the advisory board and some of the, the kind of connections you made along the way with people who, are willing to support the program, this initiative?
Yes, I approached a number of individuals who are experts in the medical, public health, social service field to join a committee, so to speak. So far, I believe we have 5 to 6 individuals who have agreed to be part of the committee. And as you indicated, Councilmember Bones, we will have to convene a meeting and convene subsequent meetings to vet thoroughly the program and also seek input and recommendations regarding the program. And as we stated, we have spent a number of months working on the design of the program, but it's also valuable to get the input of experts who are in the field regarding the direction of the program. So it's only a matter of time until we start convening those meetings, but they have accepted the request, which we are very delighted about, and I said, we'll stay tuned.
Yeah, no, the last thing I'll say is I think similar to guaranteed income, we're never going to have the money to provide a $500, monthly contribution to every individual that would income qualify for it in Evanston. But I think we're doing it because we know, one, the people that are able to receive the contribution will benefit from it. And as Director Ogbo mentioned earlier, we're going to help to create more housing stability for those families. But also it's an exercise so that we can learn about what the needs are. And that's the same thing we're doing here. We'll, just like guaranteed income and other programs, we're going to help who we can through this program. But to me, I think the biggest benefit is also we learn what works and what doesn't. and especially around the areas of behavior change. We talk about that all the time with climate action and resiliency, that in order to make a significant difference, that we're going to have to change people's behavior, change how we live our lives, and sacrifice in some sense some of the conveniences we've come accustomed to in order to improve our daily environment and our overall health. And the same is true here. We're trying to get into behavior change, which we know is difficult, it's expensive, but I think along the way we'll find efficiencies, we'll find partners in our health systems that are willing to take some of this work on themselves. And so I see this as a case study in a sense. Let's see, if we know that many members of our community suffer with chronic illness. We know what we're doing now is not changing the health outcomes. And that's evident if you look at not only this healthy plan, but the last one. We haven't made much of a difference. And so let's see if we will approach this more comprehensively, and not so, making sure that people are connected to a primary care doctor, making sure that they have a health, nutrition and a fitness plan. If we can make a difference. And again, the reason why we wanted members of our different health systems at the table with us is to really encourage them to take some of this work on as well, so that it can continue. And then again, in the same way that we're thinking about guaranteed income, we continue to help who we can when money is available. And that's all for now, Chair. Thank you.
Great. Okay. Do you have any more comments for us?
I was just going to speak to the behavior modification piece. Why the program is called Pathways to Wellness is because it reintroduces re-education pathways directly to the mobile phones or devices of the individuals, which change the behavior. There will also be a lot of re-education that happens in person with the coaches that are available, as well as, pardon me, I had a whole brain freeze. I had this whole little thought going on. But basically what we're doing is we're changing the way that people do things. Most of the chronic illnesses, let's just be honest, have to do with what we intake in our bodies. And so what we're doing and partnering with Erie Health is we're going to provide cooking classes. We're going to teach people how to enjoy their food well. We're going to be sending them information that changes the way, healthy recipes. We're going to change. And not only that, you can take medicine on time, but if you exercise and change the way that you live your life, so a lot of those things will be implemented. And then another piece, the financial literacy piece that was missing because of the E-Plan does show that we are having a lot of decline as well in the financial space. So a lot of professionals have come into the existing program and just retrain the way that we do things. So thank you guys for your time.
Yeah, thank you.
Thank you.
So, Director Ogbo, I know this is just for discussion. Does this committee need to do anything stronger than discussion, or where will the decision, how will the decision be made at council to allocate this funding?
Yeah, absolutely. We have to keep in mind that this item, as it currently stands, is for discussion. We'll have to bring it back to Human Services for consideration, and at that point it could go to City Council. So if there are any amendments or suggestions or recommendations after reading the memo that you want us to amend or incorporate into this proposal, I think now is the time, or perhaps before we meet. I'm not sure if we're even meeting in January because we don't have an abundance of items to discuss or proposals to bring to Human Services in January, because it appears that the December one is cancelled. So I believe there is some time after reading the memo that you can provide suggestions to us that we can, as I mentioned, embed, incorporate, or remove from our proposal.
But I'm assuming everybody's really ready to get going.
Okay.
So,
all right. So in this case, the next step will be bringing it back to Human Services for consideration, and after that, it will then go to City Council. Councilmember Burns, I don't know if there are any thoughts regarding the direction of things.
Yeah, I think that's the path, discussion and then introduction. Absolutely the usual path. I also just quickly wanted to point out, if you do, we went back and forth between whether or not the program was a year or 2 years. So Letitia, is this, each cohort is a year or 2 years? It's a year, right?
Yeah, 1 year, each cohort for 12 months, I think.
That's what I thought. Okay, I just wanted to make sure. So if you do the math, though, this is basically $400 a month per participant, which is basically the same as the guaranteed income program. I think is at $500 a month. So I just quickly did the math, and roughly speaking, this breaks down to the same when you look at what the monthly contribution to each participant would be. But absolutely, it's for discussion today. Next Human Services Committee meeting intro, and then hopefully it gets the support it needs to go to council for a full vote.
Great. Okay, so between now and the next meeting. Send any suggestions to.
Yeah, which appears, because we don't have a December meeting.
Right.
I'm not sure. The next meeting will be after the new year, I believe, January 2nd.
I think so, yes. Right.
Yes, I think that's the next meeting.
That was in our calendar. We could adjust that if.
Yeah, we can adjust that.
Mm-hmm. Right.
Okay.
Okay. All right.
It's to celebrate the new year.
Okay, yeah, okay. Well, thank you very much. And this is a really exciting program, so we appreciate all your hard work on this. Okay. And then our last item, we have an update from the Evanston Environment Board. And we have Matt Cotter, the Environment Board Co-Chair. Welcome.
Thank you. Sorry. All right. Thank you, Chair Revelle and committee members. Thank you for having me. As was stated, my name is Matt Cotter. I'm co-chair of the Evanston Environment Board, along with Michelle Redfield, who couldn't be here tonight. And I'm here to give the annual report from the Environment Board to the Human Services Committee. So the full report is in the packet, but since our June 2022 report, the Evanston Environment Board has worked on the following issues by researching and drafting policy, advising staff, and collaborating with community groups. So we have a few sections under the mitigating climate change. Some of the highlights are the work on the upcoming the conversion to efficient beneficial electricity ordinance. Draft language for that is making the rounds through the committees. We have a working group consisting of members of the Environment Board and the Utilities Commission. And I think the language for that ordinance will be coming to council within the next couple months. And that should be no surprise. I think we have several co-sponsors of that referral here tonight on this board. Next, we advised staff on the strategy for renewable energy credits. That went to council a couple months ago, and I think council decided the same way that the Environment Board did. Next, solar power purchase for Robert Crown, very exciting. I believe it's the city's first PPA agreement for solar. The RFC has responses, and I think the specific contract is going to come to council as soon as the legal okays everything.
Okay.
The updates to the plastic bag ordinance was something we spent time on. I'm sure you're all very familiar with that. And we're also working on a public-facing dashboard. We're advising staff on creating this, which will be a central point where residents can learn about climate action and get information about programs the city has. Under resilience, we drafted memos on the ecological landscape management, including the NOMO May discussion that happened here. We drafted a memo for the Parks and Green Space Strategic Plan, as well as working on the Strengthened Tree Protection Ordinance, which recently passed. So we're very excited about that. Next, we called out some community engagement functions. The board, as well as the subcommittees, have regular public meetings, which are decently well attended by members of the public. But in addition to that, the board worked with Climate Action Evanston and city staff to organize 3 large community meetings this year in January, April, and August, focused on connecting the community and climate action and specific things that people could do in our community. We had anywhere from over 40 to over 70 attendees at these meetings, so they were very successful. And finally, we had recommendations to this board and to council to continue your climate commitment, to continue acting urgently and accelerating implementation of the Climate Action and Resilience Plan, which has recently been adopted as a city council goal, to reflect this commitment in the 2024 budget, and to assure that city staff structure and responsibilities are directed towards implementation of CARP goals. Thank you very much.
Oh, great, thank you. So committee, any questions or comments? What is the status of the dashboard?
The dashboard, instead of going with a third-party contractor, staff decided to use Esri and ArcGIS. So there's a draft that Ben, who's not here right now, Ben is working on.
Okay.
And currently the greenhouse gas inventory is on the dashboard. And city staff are working with the CIT subcommittee of the Environment Board, the CARP implementation task force, to get more metrics and include things like the CARP action agenda and things like that on the dashboard. So it's in progress, but not public facing yet.
Right, yeah, okay. It'll be great when we get that.
Yeah.
Okay. All right. Well, thank you, Matt.
Thank you.
Yeah. Look forward to the next update.
Thanks.
Okay. All right. And that brings us to the end of our agenda. And whoops.
Sorry. Given that the item is for action, we'll have to.
Oh, dear, I'm sorry. Okay.
Take a vote.
I move for the adoption of the Evanston Environmental Board update.
A second.
Okay. All in favor, please say aye.
Aye.
Aye. Opposed, no. Okay, we've accepted and placed it on file. And I think that now that concludes our.
Yes.
Okay,
Yes.
thank you very much, everybody.
Thank you.
Thank you. Good night.